Morning, Professor Martel. This is my endocrine system project. And this is going to demonstrate how the endocrine system contributes to the development of the female reproductive system across her lifespan. First, we have the prenatal stage, and this is primarily influenced by HCG, which is produced by the placenta. Estrogen is very important for this, for maintaining pregnancy and fetal organs, liver, kidney, lungs. At this stage, it's also important to know that most of it is influenced by the person carrying the fetus, and the placenta produces many of the hormones and provides support. Um, the fetal adrenal cortex is also very active, and then we go to the infancy stage. Here is a chart kind of showing the ages and the hormones at that age and how it affects other body systems. So at birth, because of the high maternal estrogen and progesterone, it's common for infants to have breast swelling and vaginal discharge. Sometimes from 0 to 6 months, they have what's called a mini puberty with high GnRH, high LH. They have some temporary ovarian activity. And late infancy, 6 months to 2 years, very low estrogen and inactive ovaries. So, also when the placenta's actually removed, the maternal hormones rapidly drop. So, and this is important because it causes the infant's endocrine system to kind of wake up. And the active HPG axis during the 0 to 6 months is also important. Then we go to early childhood, and this is a quiet time for the endocrine system. Doesn't have much activity as far as hormonal. The LH, FSH, and sex hormones are all stable. Pituitary glands not releasing hormones. In fact, a lot of these hormones drop to undetectable levels. So no ovarian follicle growth. Middle to late childhood, this is the initial stage of development. And we have the adrenal glands increasing secretion of DHEA, the neurons, glial cells acting together to stimulate GnRH. And this stage kind of begins with puberty, and it's triggered by the reactivation of the HPG axis. And then we have adolescence. And this is a time where the hypothalamus releases GnRH, stimulates the pituitary glands to produce FSH and LH. And these produce, they stimulate the ovaries to produce estrogen and progesterone. And they circulate in the bloodstream bound to plasma proteins, and only unbound progesterone and estrogen are active. Other changes in the body systems during adolescence, skeletal system goes through big changes. There's growth spurts, bones maturing, widening of pelvis. The integumentary system, increased oil production, hair growth, sweat glands become more active. As far as like the overall homeostasis of the body at this time, what's interesting is puberty is can be altered by like obesity or malnutrition. So as far as that even happening, the body has to be in a good place, as you will. Then we have early adulthood, and this is kind of the peak of reproductive hormone stability. So we have all the hormone. We have estrogen, progesterone, LH, FSH. They're all working together to like regulate the menstrual cycle, maintain sexual characteristics, and it's all to keep fertility possible. And I have a chart right here, and the female fertility rates by age. So this is kind of the prime fertility, um, where your fertility rates are highest. And as far as what's going on in the other your other systems in the body, estrogen's also supporting not just bone strength but cognitive function and your cardiovascular health. Now we have middle adulthood, and during this stage, reproductive hormones they decline significantly. Um, the estrogen levels drop, and the number of ovarian follicles decrease, and this affects not just the menstrual cycle but brain health, vaginal and urinary tissues. Progesterone decreases, so that causes an imbalance with estrogen, and the ovaries are less responsive, so the brain releases more FSH to get them to produce more. So FSH levels are often high, and what's interesting is that's what they use to diagnose menopause. And this kind of shifts in the late 30s and early 40s. It's kind of transition time to menopause. Around this time, there's also sleep disturbances, mood swings, irregular cycles, hot flashes. As far as homeostasis, the APG axis becomes less efficient. So the feedback mechanisms to stabilize and control the hormone levels are weakened. And this compromises the overall health and makes women susceptible to illness around this time. Then we have late adulthood. Hormone levels continue to drop, and as the hormone levels fall, other changes occur. Vaginal walls become drier, um, and these are due to the drop in estrogen and progesterone. And it's not just that, but you'll have lots of changes throughout your body, your immune system, your skin, your sleep, your bones, muscles, joints, your reproductive system, obviously, but your heart and blood vessels, your kidneys, your lungs, your nervous system. Um, just kind of going through a lot, and it sounds like a mess, as this cat demonstrates. But this is also when you have to really look at like your bone density, and cardiovascular risks also shift during this time. As far as a disease or disorder, I chose the polycystic ovary syndrome, and what this does is it alters the normal. Um, it disrupts the endocrine system and leads to a hormonal imbalance, and it also causes insulin resistance. So the symptoms of this are irregular missed periods, excess hair growth where you don't want it because you also have thinning hair on your scalp, so it just grows other places. Difficulty losing weight, oily skin. Uh, it's the leading cause of infertility, and also mental health issues arise with it. The causes, environmental factors, obesity, genetics, insulin resistance, and treatments. Well, lifestyle changes, losing weight, which is seems like it's already hard to do because that's one of the symptoms. And a healthy diet rich in fruit, vegetables, limiting processed foods, foods high in sugar, um, in this economy. Medications like metformin that could lower insulin levels. And you could also take medications for infertility to stimulate ovulation if that's something you want. Thank you.